So, hi everyone. I'm Dana. I'm the Director of Brand Communications here at Beyond Type 1. We are lucky to be joined today by Dr. Mark Heyman to answer some of our staff's questions about personal mental health questions about what we're going through right now. Um, Today is March 31st. We have all been home for something like 20 days at this point. We are coming to terms with this new normal, and we are just really here to open up a roundtable discussion. Um, Dr. Mark Heyman has offered to answer some of our staff's questions about mental health, and we hope that this kind of lends some perspective to what you might be wondering about and going through right now as well. So, Dr. Heyman, do you want to introduce yourself?
Sure. I'm Mark Heyman. I am a clinical psychologist and certified diabetes educator, and my work specializes in working with people with diabetes. And certainly, this is people with diabetes have some unique stresses right now, given the COVID-19 situation. So, really excited to be here to discuss with your team, the concerns that they're having.
Yeah, thank you so much. We're really grateful. I know we're just going to dive right into it. I'm going to go over to Lala on our team with our first question.
Alrighty. So, hi, Dr. Heyman. I'm Lala. I've had type 1 diabetes for 22 years, and I'm on the digital team at Beyond Type 1. And my question is, I have managed anxiety and depression for almost as long as I can remember. And so I feel like I have a pretty strong toolkit. I have my, blood sugar management and lots of water and exercise and all that. And even still with all of that, I am struggling with a pretty high level of anxiety with this kind of new normal that we find ourselves in. And every few days that tips into just a total meltdown. And so I'd love some tips and tricks for how to manage that. And then also, I'm a little bit worried about this just becoming a habit for my brain and my body, that it's just gotten into this cycle. And I'm wondering how to maybe interrupt that.
Yeah, well, first of all, I want to say that having anxiety right now is totally normal. And so I think that the key word here is managing it. I think that anybody who's experiencing the type of stress kind of in the world today without being able to go out of our house very much and with this fear about this pandemic, I would be surprised if someone was not feeling anxiety and a little bit worried if that wasn't the case. And so I want to normalize that, that what you're experiencing is totally normal. I think that a couple of tips on how to manage that. First of all, anxiety is really about a fear about the future, whether it's a perceived threat of the future or a real threat. And so the best way to manage anxiety in this case is really to find some routine so that you have some sort of predictability during your day. Getting up at the same time every day, taking a shower, getting dressed like you're going to be going to work, I think can be really, really helpful in giving you a grounding for just your day. And so there's not many surprises as to what you know what's going to happen. That every morning you're going to get up, you're going to go for a run, you're going to take a shower, have breakfast, kind of get that normalcy into your day. I think can be a really helpful tool. In terms of becoming a pattern, I think that's a reasonable concern. And I think that a way that you can address that is by recognizing when that tipping point might be coming. And then changing the scene, kind of doing something very intentional to change what you're doing at that time. Because, our brains are really smart and they get in habits easily and we get triggered into those habits. And so if you're in the same place and all of a sudden that anxiety comes along and you do the same thing, your brain is going to start to think, well, she's doing the same thing right now. I should be anxious. And then you get in that pattern. And so if those feelings of being tipped over into that kind of panic happen for you, change the scene. Go outside for a walk and do something to calm yourself down. Get away from work for a little while and go and do something to distract yourself and to get your mind off of it. But really be intentional about that. Is a really great tool to not make that a habit. And if you see it becoming a habit, the weird thing about habits is they can be broken. You have to be aware of them though. And so being aware that it's becoming a habit is an important part. So being intentional and being aware of what's happening for you within your body, within your mind, I think can be a helpful tip for you.
Thank you.
You're welcome.
Awesome. Okay, next question is coming from Todd. Over to you, Todd.
Hi, Dr. Heyman. Thanks for taking the time to talk with us today. I'm Todd Boudreau. I'm the Director of Content at Beyond Type 1. So about 3 weeks ago, 2.5 weeks ago, right before the shelter in place in San Francisco happened, I went out to Safeway. I bought $300 worth of food. I thought, okay, this food is going to last me at least a month, maybe 6 weeks. And then 2 weeks later, I had eaten all of it. So I have a few questions. One, is it normal to be overeating this much? I think because I'm stuck at home, I'm going through food way faster than expected. I guess is that to be expected when you're kind of trapped at home? And then any advice you have or tricks, I don't know about tricks, but tips on how to not just go back and forth to my kitchen every 5 or 10 minutes to eat some more food would be very much appreciated. Thank you.
Yeah, so it's totally normal to have to be eating more, not necessarily because you're at home, but because you're stressed. And being under stress and being at home is probably stressful, not being able to leave very much, kind of having to change your routine can be really stressful. And so oftentimes we use food as a comfort, as a way to make ourselves feel better, either because we're stressed, and so it's a way to try to relieve stress, or also just as a way to get rid of the boredom and get rid of the monotony of being in your apartment or your house all day long. So that's a totally normal response to a stressful situation. So I think that experiencing that right now. The tips and tricks. Not to be so hard on yourself. This is, I think, expected, and so certainly you can try to stop, and if you want to do that, that's totally fine. But I wouldn't beat yourself up too much over it if that's happening for you. A couple of things you can do is one, people find that it's helpful to have food out of sight. So if you have food on your counter, put it away. If you have a garage, maybe put the food in the garage, and so only have the things available that you want to eat or that are there. So because if it's out of sight, then it's not going to be available to you. Also, I think that it can be helpful to have a regular eating schedule. And so, say, I'm going to have breakfast, lunch, and dinner, and maybe an afternoon snack, and kind of set those expectations for yourself at the beginning of the day, because that it's much easier to follow a plan than to kind of have a free-for-all and kind of go back and forth to the kitchen. And then finally, I think one tip that I would encourage you to use is if you find yourself eating a lot and eating mindlessly, then it is to try to eat more mindfully. And what that means is, let's say that you have, let's say you go to the kitchen and you say, okay, there's a bag of chips on the counter. Instead of taking a whole handful of chips or taking the whole bag of chips to your desk and putting it on the desk and just eating them, maybe take 7 chips out of the bag. That's a random number, but take 7 chips out of the bag and eat that chip mindfully. So pay attention to what it feels like in your hand, what it smells like, what it's like to put it on your lips and to chew it, and to be very intentional about that. That it's helpful, one, in slowing yourself down and helping you eat more slowly, and to not overeating, but also to really appreciate what it is that you're eating and to experience that, because there's nothing worse than having a great snack but scarfing it down and not really being able to enjoy it. So if you're going to have the food, eat it slowly and really enjoy every aspect of it using all of your senses.
Awesome. Thank you so much. Yeah, I guess that makes a lot of sense. I hadn't even thought about the fact that it probably is a lot of stress eating. It's not just being trapped at home. There's just a lot of stress going on. So it's good to hear that I'm not alone in this. I think it's an issue that a lot of us are facing right now.
Sure. Yeah, I certainly am as well. Being at home, it's I think it's kind of par for the course. And so if that's happening, and it's not a big problem for you, it's not impacting your blood sugars. It's you're not beating yourself up over it. I would give yourself some slack and let it be, because this is going to end at some point. You don't know when, but when that happens, you can kind of get back to normal. What we don't want to have happen is to become a pattern, though, and to kind of have that bleed into when you do go back to work. It's like, okay, well, I just need to be eating all the time.
Great. Thanks again.
You bet.
Cool. Okay, our next question is coming from Tiara. Tiara, do you want to jump in here?
Yeah. Hi, Heyman. Tiara, I'm the project manager of Beyond Type 2. I've had diabetes for almost 3 years. And during this pandemic, I've been feeling really anxious about bringing up the worst case scenario to my family members, which is death. I live alone in the Bay Area, and so we're trying to prepare for emergencies, but we haven't necessarily talked about what happens if I pass away or another family member passes away. So I would love some ways to approach this topic with my family.
Yeah, that's a really scary conversation to have, and probably scary for you, but also scary for them. And if that's an important conversation for you to have, I would be honest with them about your feelings. I would say, mom, dad, brother, sister, whoever you're talking to, this is really hard for me to talk about, but I think that it's important that we have this conversation. And I think by laying your feelings on the table and letting them know how you're feeling about the conversation, it'll make it a little bit easier to move on. Because if you go and you're like, I wish I got death, and they're like, whoa, and they're feeling really anxious and they think that you're not, that's going to make it really weird. But if you go in and you're vulnerable and you say, this is a tough topic, but I think that we should have a conversation about, what happens if something awful. And I'm really uncomfortable talking about this, but I think it's an important one. It makes everyone kind of feel like they're on the same page. And it's much easier to have that conversation, or it's never easy to have that conversation, but it's much easier to have that conversation if everyone knows that everybody else is having a hard time. Because, these are never easy conversations to have. And I'm really glad that you're thinking about, having them. Because I think it'll serve you well now, but also once we get through this, I hope it'll serve you well in those tough conversations in the future with your family and friends and loved ones.
Thanks a lot for that. That vulnerability is really important, which is something that I know we're not the best at least in my family, but
Yeah.
It feels like we're waiting for one of us to kind of have that moment. So I'm willing to kind of take that step and be vulnerable first, and then see how they react.
I think vulnerability is I think we have the wrong impression about it. I think oftentimes, and this is like not only with this topic, but with diabetes and with other tough conversations, is that by being vulnerable, you're actually providing people with some peace and a model that a model that they can use. Because as I told someone before, I would be worried if you weren't anxious about this situation, or worried about anxious about talking to your family about these tough things. And that's normal. And we want to normalize that, because if we normalize it, then no one has to feel like they have to be the tough one and be the strong one. Because at this point, it's really hard for any of us to be the tough and strong one, because we're all really scared. And then if we pretend like we are, then we're basically, we're not being authentic to ourselves and what our needs are.
Yeah, awesome. Thank you so much, Mark. That's I don't know, I'm just grateful that we're able to have the conversation about a tough topic. I think it's on a lot of people's minds. So we're hoping to kind of open that door to conversation for our community as well. So thank you, Tiara, as also. And I know we have time for one more. So I'm going to hand it over to Jordan for her question.
Hey, Mark. So I'm Jordan Dakin. I'm a senior manager on the digital team at Beyond Type 1. And my question has to do specifically with time, because I know for me, I'm just finding the days are passing differently than ever before. And we've just received this new guidance that, everything is probably going to stay the same for another month. Well, I know for me, last week alone felt like a month. So I guess I should feel good that the days are lasting longer, but it just feels so life-altering. So I guess I'm just wondering how I can cope with this new concept of time, and how I can cope with struggling with just waiting and kind of this anxiety of not knowing what's going to come of this situation.
Yeah, that's a great question. That's a really tough one. And I would give you a couple pieces of advice around that. The first is, finding ways to structure your day. So, I think that what I'm hearing you say is that it's almost like the future is this big, vast unknown. You don't really know what to expect tomorrow or next week or next month, or how long this is going to last for. And you're right, that's the case. but finding ways to structure your day to sort of make your days a little bit more predictable and structured can be helpful in helping you to kind of have a sense of security and to the extent that that's possible right now. The second thing I would suggest that you do is, be very mindful. If you know me at all, you know that I'm a big fan of mindfulness. And so because what can happen here is that your thoughts can just kind of get away from you. And so you're kind of in this big unknown. And then your thoughts have lots of places that they can go, and they can oftentimes go to some really scary and dark places. And so being present in the moment, even if that moment is scary, it can be a lot easier than being lost in your head. And that can give you a sense of grounding and a sense of security. The third thing is, I would really suggest that, and I know that a lot of us have been doing this, is take advantage of this time for yourself. As scary as that is, find something new to do. One that can structure your day. So if you want to learn to draw or learn to play the guitar or learn to, whatever it is that you want to do, take advantage of it and hopefully find some joy in that, because the big unknown is really scary and can be, I think oftentimes can be void of joy. And so we can find things that we enjoy, especially if they're new. We can find some gratitude in this scary and unknown place. And gratitude can go a long way in helping us to feel better and more hopeful. Because I think at this point, what we really all need is to feel hopeful that hopefully we're all going to be okay and that our families are going to be okay. And also hopeful that this will end and bring us to hopefully a better place after it's over, even though we don't quite know when that's going to happen.
Yeah, totally. Do you find that, in practicing being mindful, that maybe like meditation is the best way to do that? Like, do you have any specific tips around that?
Yeah, of course. So mindfulness is a practice. And for those of you who aren't familiar with mindfulness really means being in the present moment for whatever's happening for you without judging it. So oftentimes we say, oh my gosh, I'm here and I'm feeling anxious and I shouldn't feel anxious. And you beat yourself up for feeling anxious or for feeling scared or whatever. And the reality is that whatever's happening for you, whatever thoughts and feelings or sensations, urges you're having in this moment are totally normal. And there's nothing to judge. You shouldn't be judging yourself about those things. That can actually make it a lot worse. But the thing is, that's not something that that's not something that we do naturally. And so practicing, having a mindfulness practice can be super helpful. So there's some great apps out there that you can download. My favorite is Headspace. There's also Calm and a couple of other ones that have some really great resources that you can use to practice mindfulness. So, you can do a 10-minute practice or a 5-minute practice every morning. And then as you're going throughout your day, you can, when your mind wanders away from where you are right now, those types of practices can help bring you back. Because the goal here is not to have your mind wander. Your mind is going to wander. You're going to go off into some places. But to be aware when that happens and to bring yourself back. And just like if you're learning to play the piano or you're learning to do something new, you don't just like go out and play a concert, right? You practice on a daily basis. The same thing is true for mindfulness. You can't just say, okay, I'm going to be mindful today and expect that to happen. It's not going to. But you have to kind of build that muscle. And so by doing it, by just sitting and being, or by using an app to help you, that can be a really effective tool in helping you to build that skill that then you can use throughout the day when you're at work with your friends and family, over Zoom, not in person, and kind of living your life and doing what you're doing. It's even with this vast unknown future that we have right now.
That's super helpful. Thank you so much.
You're welcome.
Yeah, so that kind of brings us to the end of the questions that we came here with. I want to say, if anybody is watching the recording of this conversation, we want to know what questions you have. So please let us know, reach out on social media, comment on this video. We want to know what you're going through right now, where your head is at, and how we as Beyond Type 1, Beyond Type 2 can best serve you and your mental health needs right now. This has been kind of a little peek into what has been going on personally with our staff right now and some of the conversations we're having. And I hope that us opening up and being vulnerable has been helpful to getting this conversation started. But we're here and we want to hear from you as well. And then to that effect, I guess I'll just open it up. If anybody has like kind of follow-on questions, additional questions from the team here today, I think we have an opportunity to talk a little bit more. Anybody, any last thoughts?
I have a thought, if you don't mind.
Yeah, please.
You know, it's really interesting to me what's happened over the past last 2 or 3 weeks with regards to how the healthcare system has changed. You know, I saw my endocrinologist last week over video, and I see patients over video all the time. But what I realized is that many of my colleagues, my psychologist colleagues who don't do diabetes stuff, have really started using telemental health really widely. And so if you're stuck at home and you feel like you need some support, don't let being at home be a barrier to that. You know, I think that the vast majority of mental health professionals right now are seeing people over Zoom or over a lot of the other telemedicine systems. And so please know that that support is there for you if you need it. Whether that's diabetes specific support or whether that's just general mental health support in general. You know, look for somebody in your area or look for somebody in your state who provides this types of services and know that it's there for you right now, and use them if you feel it would be helpful.
Yeah, I think that's an awesome note. And if you are feeling anxious and overwhelmed and you need to reach out for help, that is like so normal right now. And we hope this is like a great example of just knowing like you're not alone with those feelings. Reach out, check out the Beyond Type 1 coverage as well. Everything is kind of getting put together at beyondtype1.org/coronavirus, also on Beyond Type 2 and also in Spanish. So we're working to cover everything: mental health, physical health, just general well-being, and the way our health system is changing with our team at Beyond Type 1 and Beyond Type 2. So keep your eyes there. And lastly, I just want to say thank you. Thank you for this time and this conversation. And you know, we'll keep the line of communication open as things continue to evolve here.
Yeah, you're welcome. Thank you guys.
All right, awesome, cool. Have a great rest of your day. And we will talk soon.